Cardiovascular disease is a significant issue for modern people. In the past, it was believed that blood vessels aged with time, making these diseases more common among the elderly. However, today, the incidence of cardiovascular disease has skyrocketed not only among the elderly and middle-aged but also among young individuals in their 30s. Being young does not guarantee immunity from cardiovascular disease. Why has this happened? And are hypertension and diabetes, which are commonly known as the main causes of cardiovascular diseases, the only culprits? Cardiovascular diseases, such as arteriosclerosis and stroke, are primarily caused by blockages or ruptures in blood vessels. As our parents age, these diseases often occur naturally. Heart attacks and brain hemorrhages caused by cardiovascular diseases have extremely short golden hour periods for intervention. Therefore, sudden deaths are not uncommon for patients with these conditions. If you have hypertension or diabetes, which are common in modern times, it's like living with a ticking time bomb. However, after much research, it has been discovered that vitamin C has tremendous effects on cardiovascular diseases. There are numerous reports of people experiencing amazing results in preventing and managing cardiovascular disease through high-dose vitamin C intake. This method is famously known as the megadose therapy. Today, I will explain the actual causes of cardiovascular diseases and why the megadose method is beneficial. By watching this video, you'll gain knowledge about preventing and managing these scary cardiovascular diseases as well as the correct ways to take vitamin C using the megadose method. What are the main causes of cardiovascular diseases? Traditionally, internal medicine has defined hypertension and diabetes as the primary causes. Thus, many people have believed that hypertension and diabetes are the main reasons for blood vessel aging. However, starting in the 2000s, there have been reports from many hospitals about younger individuals in their 30s without a family history of hypertension or diabetes being hospitalized for cardiovascular diseases. This includes individuals in their 40s and 50s. This means that there are other critical causes beyond hypertension and diabetes, and researchers have finally identified the culprit: oxygen-free radicals. The role of oxygen-free radicals explains why it is necessary to consume large amounts of vitamin C. So, what exactly are oxygen-free radicals? When you leave iron exposed to the elements, it rusts. Similarly, our bodies breathe oxygen to generate energy, which is a process called oxidation. During this process, oxygen-free radicals are inevitably created. However, excessive production of oxygen-free radicals can harm the body. They can oxidize and damage the endothelial cells of blood vessels. Similar to how iron rusts, oxygen-free radicals accelerate cell aging, contribute to cancer formation, and cause arteriosclerosis. For arteriosclerosis to occur, the endothelial cells of arteries must be damaged first. Without damage to these endothelial cells, arteries would not harden even under high blood pressure. Previously, it was thought that high blood pressure and high blood sugar were the primary factors damaging arterial endothelial cells. However, it is now believed that oxygen-free radicals, which oxidize and damage blood vessels, are even more dangerous. When oxygen-free radicals are generated in the body, they circulate through the bloodstream, interacting most frequently with the endothelial cells of blood vessels, accelerating vascular aging. In the past, the amount of oxygen-free radicals naturally produced in the body was not sufficient to cause significant endothelial damage at a young age. Typically, this process began affecting arteries in the 60s. But in today's society, extreme stress is prevalent. This stress leads to increased energy consumption and a surge in oxygen-free radical production. The high levels of free radicals in the blood become a powerful factor in vascular aging. To make matters worse, oxygen-free radicals interact with another substance, creating a catastrophic situation. This explains why even young individuals in their 30s without hypertension or diabetes are being hospitalized for cardiovascular diseases. What is this other substance? It's cholesterol. Cholesterol is often viewed negatively as a substance that clogs blood vessels. But is it entirely bad? Cholesterol actually plays essential roles in the body. Healthy cholesterol circulates in the blood, serving as a vital raw material for various processes, without causing damage to the arterial endothelium. However, when there are high levels of oxygen-free radicals in the blood, they interact with cholesterol, oxidizing it. This oxidized cholesterol becomes a key factor in damaging the endothelial cells of blood vessels, eventually leading to its deposition and arteriosclerosis. Fortunately, there is a solution: vitamin C. Vitamin C significantly reduces the concentration of oxygen-free radicals in the blood. This means it has a potent antioxidant effect that prevents aging. By consuming vitamin C, you can simultaneously reduce the harmful effects of oxygen-free radicals that accelerate arterial aging and prevent healthy LDL cholesterol from oxidizing and depositing in blood vessels. This highlights the importance of consuming vitamin C in large quantities through the megadose method. There are numerous positive cases of vitamin C megadosing with remarkable results. Let's now discuss the megadose method for taking vitamin C to combat oxygen-free radicals and its correct consumption method. Megadosing with vitamin C does not mean consuming an unlimited amount. According to various clinical studies, the recommended daily intake for the megadose method is 12 grams. This amount is typically divided into 3 doses of 4 grams each, taken with meals. There is a belief that excessive vitamin C intake is pointless as the unabsorbed portion is excreted. However, even during the excretion process, vitamin C positively transforms the environment of the urinary tract and colon by converting harmful bacteria into beneficial ones. This is why 12 grams per day is recommended. It is best to take vitamin C after meals or while eating to avoid stomach irritation, as vitamin C is acidic. Additionally, vitamin C helps inhibit the formation of nitrosamines, carcinogenic substances that occur during the digestion of meat. One caution is for individuals prone to urinary stones. In such cases, the metabolic byproduct of vitamin C, known as calcium oxalate, may accelerate stone formation. To prevent this, individuals with a history of urinary stones should drink plenty of water and urinate frequently, about once an hour. For individuals without a history of urinary stones, there are no issues even with large doses of vitamin C. Megadosing is particularly effective in preventing and treating cardiovascular diseases and has shown benefits in other health areas. Many cases even report that individuals prone to frequent colds no longer get sick after starting megadosing. We have discussed the primary cause of cardiovascular diseases, oxygen-free radicals, and how to address it using vitamin C megadosing. Don't take your health for granted just because you're young. Modern stress and excessive eating habits are rapidly damaging your vascular health. Why not try the vitamin C megadose method to protect your blood vessels? We will continue to bring you not only product reviews, but also essential health information. Please subscribe, like, and hit the notification bell. Thank you.